vaccine for HPV that's been out and is recommended by the CDC, starting at the age of 11 to 12 or earlier for high-risk individuals. Routine vaccination is now integrated into childhood vaccinations and it's recommended for children aged 11 to 12. And 2 or 3 doses are recommended depending on the age at initial vaccination. So if you're vaccinated from 9 to 14, it's recommended to have 2 doses, essentially one at baseline and another one at 6 to 12 months later. Whereas if you're 15 years of older, it's recommended to have one at baseline, another vaccination at 1 to 2 months later, and the third vaccination at 6 months later. There's a lot of questions about older individuals and whether HPV vaccination is recommended, specifically in individuals aged 27 to 45. And here it's important to talk to your healthcare provider about the pros and cons and benefits to you as an individual about vaccination. A lot of the recommendations come from essentially what are the exposures and risk factors for you as an individual. And it's hard to put it in a big perspective, but the pros and cons can be discussed with your primary care doctor. What we know is that the HPV vaccination reduces cervical precancers. Here we can see that from 2008 in the darker bars to 2016 in the lighter bars, we can see a dramatic reduction in precancers of the cervix in women across the United States. And this is the evidence of a successful vaccination campaign. In addition, it's been shown that HPV vaccination has had about an 88% reduction in oral HPV infections among young adults who receive at least one dose of the HPV vaccination. The HPV vaccination is most effective during adolescence, and the younger age at immunization is associated with increased vaccine effectiveness. And so what you see here is that the older you get, the effectiveness for the HPV vaccine to prevent pre-cancer of the cervix significantly decreases the older you are. And this is one of the reasons why vaccination is recommended as part of our routine childhood immunizations. More recent data has shown that besides preventing precancers, the HPV vaccination can even prevent cancer itself. Among vaccinated women in Finland, they found essentially a near universal reduction or elimination of HPV-associated cancers in vaccinated women. This is the first intention to treat evidence that vaccination protects against invasive HPV-associated cancers. HPV vaccination has the potential to eliminate cervical cancers. What we've seen in the United States is that despite cervical cancer being one of the leading causes of cancer deaths in the past, it's now significantly dropped. And this is due in part to a successful integration of HPV vaccination into our childhood immunizations. About 90% of cervical cancers can be prevented with an HPV vaccination. HPV vaccination is safe. Over 270 million doses have been distributed worldwide since 2006, of which 100 million doses in the United States alone. The CDC and FDA closely monitor the safety of the HPV vaccination, and any safety concerns are brought to the attention and reported to health officials, healthcare professionals, and the public. Unfortunately, despite being such an effective cancer prevention tool, HPV vaccinations lag behind other childhood vaccines. This is unfortunate, as this vaccine has the ability to protect, or in some cases, eliminate HPV-associated cancers from our children. HPV vaccination is really cancer prevention. Boys and girls should get the HPV vaccination series by the age of 13. In some high-risk individuals, they can start the vaccination process as soon as 9 years of age. I've already shown you evidence that the vaccine works. Since the release of the vaccine, infections that cause most HPV-associated cancers have significantly decreased. And we've even seen emerging evidence that the vaccination prevents or eliminates cancers. It's our goal to discuss the vaccination against HPV with our healthcare providers, and I hope your healthcare providers bring it up in discussing it with you as part of the normal and routine childhood immunizations. A lot of parents ask questions about why their children need HPV vaccination, and I think that's a very logical question. So why do they need it? How does it work? And why do they need it at such a young age? And we've covered some of these topics today. We need it because it helps prevent against a common infection that causes cancer. The data has shown that the HPV vaccination prevents precancers as well as cancers from forming, and that the effectiveness of the vaccine is much higher the earlier we vaccinate our children. It's okay or normal to have concerns about the HPV vaccine. And oftentimes I get asked, is this going to make my child thinks it's okay to have sexual intercourse? But this is just like any other childhood vaccination. It's really focusing on a common infection that can be spread, yes, through sexual intercourse, but also through non-sexual intercourse manners. And there's lots of data showing the safety of the HPV vaccination, not only in the United States, but all over the world.